In this video, I'm going to talk to you about 10 atypical symptoms of endometriosis. And the reason this is so important because it underscores a couple of key features that we now understand about endometriosis after decades of kind of getting it wrong in medicine. So traditionally, we've thought about endometriosis as a pelvic disease, but we now know that endometriosis is indeed a systemic disease. It is systemic. There's many different manifestations throughout the body. So we're going to go over about 10 of these today to underscore this very important concept of endometriosis being a whole body process. So starting from the head, we're going to work our way down through the body. Number one, headaches. Headaches make sense for endometriosis because endometriosis is a pain-associated disease. And we know that everybody experiences pain in a different way. And so your nerve fibers can kind of get ramped up and your headache predisposition may be a certain way. Number two, anxiety and depression. Now you might think, well, of course, if you have chronic pelvic pain, you're going to be depressed and you're going to be anxious about getting another episode of it. But in animal models, we've actually induced these states of depression and anxiety behaviors. In other words, it was more of a causation caused by endometriosis. Number three, fatigue, either associated with insomnia or not. Number four, shoulder pain. I'm going to couple shoulder and the diaphragm, which is this kind of separation between your chest and your abdomen. Endometriosis can get in there and it can affect that, and so you can get some shoulder pain associated with it. This is kind of a relatively rare thing, but the key tip off here is that it would be cyclic. It would be associated with the menstrual cycle. The same holds true in our next body point, which would be the chest. Number five, cyclic cough or chest pain or even cough with some bleeding. So you can have endometriosis infiltrating the lungs, and a tip off here would be something associated with menstruation. Now, as we make our way down the body, we're going to get in some very common things because we're getting closer to the pelvis. So first of all, gastrointestinal, your bowel. Very common to have diarrhea, constipation, bloating associated with menstruation. These can be a tip-off that maybe this is endometriosis. Number seven, spotting after ovulation, but before the period starts. This is a classic association with endometriosis because it gets into this discussion about progesterone resistance. Progesterone is the hormone that needs to be present and active and working after ovulation to support implantation and then pregnancy subsequently. And if there is resistance to progesterone, as occurs as endometriosis, this can then surface as spotting. So this could be the only isolated symptom, the only clue of endometriosis that you had some spotting during that second half of that menstrual cycle. Number eight, genitourinary complaints such as frequency, meaning having to go to the bathroom a lot. Those are classically associated with endometriosis as the bladder gets irritable with all the inflammation of endometriosis. Number nine, the skin. Acne has been associated with endometriosis, and this is probably due to the hormonal fluctuations. And finally, number 10, joint pain. There has been an association between joint pain as a result of something like lupus or rheumatoid arthritis and some crossover with endometriosis. We both think of them as states of inflammation with some autoimmune component, and so it would make sense that this can be more of an atypical presentation of endometriosis. So it's important to remember that infertility or trouble conceiving could be the only symptom of endometriosis, and that these more atypical ones don't necessarily need to be present. So if you don't have these, it doesn't mean that you can't have endometriosis. But the point being that we have to change our thinking and create this awareness that endometriosis is a whole body process.